is a okay, this meeting is now streaming live. This is a voting session on several bills before that have been referred to the subcommittee by the full committee. And this meeting is being recorded. And
Look what I just picked up off the printer.
we will begin with House Bill 146. Council.
So we discussed this bill last week. It's a departmental bill that authorizes any health occupations board that does not otherwise have statutory authority to do so to adopt regulations establishing reciprocity for individuals who are licensed or certified in another state or jurisdiction that also offers similar reciprocity to individuals licensed or certified by the board. The subcommittee last week did adopt one amendment that strikes the words "or jurisdiction" from the bill. And then there was also discussion, another amendment proposed by the Dental Association.
Well, Dan, please make this very brief because we did have a discussion last week. Dan Doherty.
Exactly.
And yeah.
Thank you, Mr. Chairman. Let me very briefly say that we totally support reciprocity. We want portability, unfortunately, because of a unique provision in the dentistry statute. Reciprocity doesn't work as long as section 4-306 continues to exist, because it allows a one-way street in where an out-of-state dentist can be licensed within about 15 days. There's no motivation for another state to grant the same thing. At your request, Dr. Morris and I and counsel for the board met on Tuesday for about a half hour. We discussed the amendment. They are not in agreement with this amendment. We discussed proposals of having a trigger when certain things happen. The provisions of this bill would go into effect for dentistry, and at the point the reciprocity was adopted, that section 4-306 would then become null and void and repealed. Council would not agree to that, so we're at a stalemate. If the committee is of a mind to look at that type of an amendment, I will be glad to prepare it and get it to council the first of next week.
Okay. Is there, Mr. Morris, very briefly, please? You're on mute. You're muted.
Excuse me, there we go.
We're good.
Thank you. Of course, right now we have licensure by credential. Somebody coming from out of state, they fill out an application and they can, as Dan said, they can get a license rather quickly. It works well. The effect of the amendments, however, are to eliminate licensure by credential. In other words, if somebody wants to come into the state, if their state does not have a reciprocity agreement with Maryland, they can't come in. But what it does, it requires then for the board to essentially negotiate reciprocity agreements with 50 states. That's not a practical thing. I think there are ways around this, but it's not the way to do it. And what it would do, it would prevent us from receiving applications, licensees from out of state. I think that would be, I think it would be a disservice to our public and to the patients of Maryland in terms of oral health. So that's basically my argument. I think.
Thank you. Thank you. Is there a motion before the body? Is there a motion on the amendment or no, to offer the amendment? Chair seeing none, is there a motion on the bill as it has been amended? We adopted an amendment last week. So is there a motion for a favorable with amendment?
Mr. Chair, thank you, Mr. Chair. I move that I ask that we move the bill as it was amended last week.
Is there a second? Is there a second? Delegate Bagnell seconds. All those in favor of the bill as amended signify by saying aye.
Aye.
Is anyone opposed? Please signify by raising your hand electronically. Okay, so Riley, Morgan, and Hutchinson are opposed, and there are 1, 2, 3, 4, 5 in support. There is a majority of the bill moves favorable with amendment. Thank you. House Bill 152, Department of the Environment, Study on Death Care and Funeral Practice, Delegate Boyce, favorable.
This bill, sorry.
Council, please, sorry.
This bill requires the Maryland Department of the Environment, in consultation with the Department of Health and Department of Labor, to conduct a study of the impacts of death care and funeral practices on the environment and public health of the state. The study must examine the environmental and public health impacts of casket and vault burial, mausoleum burial, casket-only burial, natural or green burial, cremation, alkaline hydrolysis or water cremation, resomation or natural water cremation, and natural organic reduction. MDA may consult trade groups or organizations and academic institutions to complete the study, and MDE must report its findings and recommendations to the Governor and General Assembly by October 1st, 2025. There are no amendments on this. This is a prior introduction. It was House Bill 869 of 2023, which passed HGO 18-5 and the House 106-29.
Is there a discussion on the bill? Is there a motion on the bill?
Move the bill, Mr. Chair.
Second.
And moved and seconded for favorable. All those in favor of the favorable, please say aye.
Aye.
Or is there anyone who wishes to be recorded in the negative? None. Bill moves unanimously a favorable. House Bill 628, Health Occupations, Clinical Marriage and Family Therapists, Reciprocal Licensing.
Sorry, Delegate Rosenberg. We sent an updated agenda this morning that added House Bill 380 to the agenda.
Okay, my mistake.
We don't have to go in that order. I'm just.
Oh, okay. You're very good to your chair. House Bill 628, please summarize, council.
So House Bill 628 requires the State Board of Professional Counselors and Therapists to waive the education, experience, and examination requirements for licensure as a clinical marriage and family therapist for an applicant that is licensed or certified to practice clinical marriage and family therapy in another state, territory, or jurisdiction if specified requirements are met. There were no amendments.
Is there any discussion on the bill? Is there a motion on the bill?
Move the bill, favorable.
Second.
Delegate Morgan?
Yeah, I just had some discussion on that. What requirements are we removing, Lindsay?
It's Lisa, but
I'm sorry, Lisa.
that's okay. So it's not removing, it's allowing the board to waive the education, experience, and exam requirements. Now, there is still a requirement, or the board could still impose a requirement that an applicant pass an exam of specified state law if they chose to. You're muted, Delegate Morgan.
Okay. Thank you for the information. The only reason I'm asking is because we've been doing a lot of raising the education and lowering the education level of different bills this entire session. And it's been kind of,
Hey there.
I'm looking for an overall policy, I guess, of why.
Sponsor the bill, Delegate Johnson.
Thank you, Mr. Chair, and thanks for that question, Delegate Morgan. In all 50 states, the requirements are very similar for a marriage and family therapist. And so what we're doing is not reciprocity at all. It's streamlining our process so the board is not doing duplicative work. These are not people right out of school. They have to be licensed.
A year?
They have to be licensed in another
That sounds
state
right.
already.
So just
And
do it the before, is that, and then
If
do they
someone
need
is
anything
talking,
before
we
that?
can hear you. Please mute yourself.
Okay.
If
It's
you are
Delegate
not-
Solomon's. I believe it's Delegate Solomon's office.
Okay.
I'm not sure who's on for them.
Thank you.
oh, thank you, Mr. Chair.
Certainly.
So there would still be a couple requirements. The board would ask the applicant to complete 2 Maryland-specific
Yeah,
requirements.
that sounds good.
And that would be a criminal history records check and a Maryland exam on state jurisprudence.
Right.
exam. Somebody's still not muted.
Okay, I appreciate the information, I appreciate the information, Delegate Johnson. If we want to move,
Folks,
And the board
please.
supports this bill.
19,
Mute yourself.
20,
You'll be
21, 22,
recognized.
23, 24.
It's
See,
still
they're
Delegate
4 years.
Solomon's office. Eden Durbin, if you could mute, please.
Okay, well, that's,
Okey doke.
I appreciate the information, Delegate
Lisa,
Johnson.
you're
I'm gonna
more persuasive than I am.
Yeah. And the board supports this bill.
Yeah, I appreciate the information, Delegate Johnson. I'm going to vote for the bill if we want to move things along.
Okay. So is there further discussion on the bill? You have the votes, Ms. Katrinik.
No, if there's no further discussion, I don't need to speak, but thank you for calling on me. I just wanted to share what you already reiterated. There is no lowering of education. It's just streamlined because the board staff is overworked, and going back and getting people's transcripts from 30 years ago is really cumbersome. But these people have to have been licensed and have to have a 60 credit marriage and a master's degree. So there's no change in the level of training. Thank you.
Thank you. Ms. Trescott, do you have anything to add?
Thank you, Mr. Chairman. I represent the licensed clinical professional counselors of Maryland, and we were favorable on House Bill 146 because it requires a two-way street for reciprocity. This bill does not. And also on 146, it requires substantially equivalent standards for professional licensure, which we feel very strongly about. In reviewing the Association of Marital Family and Therapy Regulatory Board information for state licensure comparisons, I found 18 states with language that included equivalent, substantially equivalent, or by review of the board. There were 5 states having different requirements in education. For example, some only requiring 48 graduate semester hours, and others having different hours of supervision required. Therefore, we were requesting an unfavorable report. Thank you.
Robin Elliott?
Good morning. I'm here today on behalf of the Marriage and Family Therapists, their national association. And Delegate Morgan, maybe this might help answer your question. The Marriage and Family Therapists looked at doing a compact, which is what you've seen for most other professions. But because half of marriage and family therapists live in California, that's a state that doesn't do compacts, that they can't do that instrument because the math just doesn't work. You need a certain number of practitioners in
Okay.
the compact.
I appreciate the information. I'm good. Thank you.
Okay. Thank you.
Ms. Katrinik, you've been heard before, so we're going to move on. Is there a motion on the bill?
Move the bill.
Second.
So moved and seconded. All those in favor say aye.
aye,
Anyone opposed? No one opposed. Ms. Katrinik, please put down your hand. You almost got a vote there. Okay, thank you. Let's go back to House Bill 380, State Emergency Medical Services Board Licenses and Certificates. Delegate Solomon's bill. Counsel.
This bill was actually discussed in subcommittee last week. The bill prohibits the State Emergency Medical Services Board from requiring as a condition for licensure or certification that an applicant provide proof of lawful presence in the United States or have a social security number or individual taxpayer identification number. Last week, the subcommittee discussed an amendment, which was actually from the chair. I miscategorized it last week as coming from MIA. That amendment would have also prohibited MIA from requiring proof of lawful presence or a social security number or ITIN as a condition for licensure as an insurance producer or non-resident insurance producer. The chair would like to withdraw that amendment.
Okay, so there is no amendment.
No amendment.
This would be on the bill as introduced. Delegate Hutchinson.
Thank you, Mr. Chair. So when this bill was presented in committee, I actually saw this as maybe a positive to help our struggling volunteer firefighters and EMS units around the state. And so I was looking more favorably towards it, but I did reach out to the State Firemen's Association, and they actually came back and said, there's really monitoring the bill, but they don't see that it would help them because to become a volunteer fireman or EMS, you would have to have a background check done, of which you need to have a Social Security number to have a background check done. So I wasn't sure really what we're trying to accomplish here. If anybody in the chat could, or the group could enlighten me a little bit further based upon that information.
Eden Durman from Delegate Solomon's or Delegate Cullison. Delegate Cullison, you're muted.
I don't have, thank you, Mr. Chair. I don't have an answer to the question, but my understanding that the genesis of this bill was to allow someone to be a licensed volunteer fire and EMS person. So with the recognition that if they wanted to be a paid firefighter, they would have to go through the process of I think they can use their ITIN number as well as a Social Security number for a background check, but I'm not positive about that. So I guess what we're seeing, at least in this one instance that Delegate Solomon brought to us, is a young woman who had been volunteering, but could no longer do it, couldn't expand her volunteer services without this bill.
Thank you, Vice Chair Collison. That was my exact question, because I really did think this was going to help the volunteer fire corps around. I have 28 of them in my district, and they're struggling to find members. But that's what I heard from the State Fire Association. It would, even if be a volunteer, you have to have the background check. And they were, at least their understanding was that it had to be a Social Security number. I can't confirm or deny I-10 would be applicable.
Mr. Kaufman?
Yep. Oops, there you go. The young lady that we brought to the board, and Mr. Solomon brought the change for, went through a background check, passed, and that was not a problem. The first time she had any problem was getting her EMT license from MIMS. Thank you.
Delegate Cullison, thank you, sir. Delegate Cullison? Okay. Is there a motion on the bill as introduced?
Move the
Is there-
bill.
Delegate
Second.
Lewis, favorable, seconded by Jennifer White Holiday. All those in favor of the bill, does anyone wish to speak on the bill? We've had the debate, okay. All those, whoops, Delegate Morgan. Oh,
Sorry, Delegate Lewis here.
Thank you, Mr. Chair.
wait a second.
Oh,
Delegate-
sorry.
Am I first or is it Robin? Okay. I
Delegate
just wanted to
Morgan,
ask
go ahead.
just a quick recap. I don't want to belabor this point. What does the bill do now? Does it include, do you have to be a lawfully present citizen to apply for this?
So the bill says that the EMS board cannot require, as a condition for licensure or certification, that you have lawful presence or a Social Security number, ITIN. Again, that's just for your licensure or certification requirements. It doesn't change any of the other requirements. It doesn't change anybody's hiring requirements.
Okay, hold on. Hey, thank you, Lindsay.
Delegate Lewis. You are recognized.
Thank you. Thank you so much, Mr. Chair. I just want to make sure, I realize, I just want to make sure I get it. This
Sure.
is a bill that will help to increase the number of volunteer EMS personnel by removing an obstacle to qualification, and that is making I-10s, acceptable for a background check. This is going to help us increase the number of EMS volunteer personnel. Yes or no?
So to clarify, this doesn't change any requirements for a background check. If you need to have an ITIN or a social security number for a background check, you're still going to need to have that. We passed a similar bill last year for the health occupations boards. Many health occupations also require a background check. So to the extent that you need that to get a background check, which I can't speak to, that requirement would still be there. If your job doesn't require a background check, or if you can get a state background check without having those, then you can still get the background check then. This is just a requirement for your certification or your license. And in this case, in this bill, from the EMS board.
Thank you, Lindsay. Mr. Chair, if I may, I still don't understand the point of the bill. If it's not removing an obstacle to certification or licensure, our goal always being increase the number of frontline health workers, frontline emergency workers. If this isn't reducing barriers to entry to that profession, what does this bill do? Sorry, I might be really slow today. Thank you.
Let me call upon Ms. Durbin from the staff of the sponsor of the bill.
Yes, the actual, Delegate Solomon is in the waiting room. If someone could let him in.
No,
we could
he's
hear
here.
you.
He's on. Jared, you are delegate. You are recognized.
Yeah, thank you, Mr. Chair. What was the question again? I'm sorry, I was just signing on.
You're still on the House floor.
I was trying to catch up on my reading. Sorry about that. What was the question, Mr. Chair?
Council.
May I, Mr. Chair? Oh, sorry.
Okay, go ahead, Delegate Lewis. Fine.
Thank you so much, Mr. Chair. My question for the bill sponsor, who's sitting behind me, is how does this bill further our goal of increasing the number of frontline healthcare and emergency workers? I'm not understanding, and it's probably just me, so if you could keep it at a 5th grade reading level, but my understanding was that the purpose of the bill was to reduce barriers to entry by making it easier for folks to qualify as volunteer EMS personnel.
Correct. So the example that we used during the hearing with Maddie from our community was so she is not able to get her certification to be a full EMT because they require essentially proof of citizenship in order to get it. So this doesn't do anything to change the actual licensing requirements or the educational requirements. But what it does is eliminates it's essentially the same things that we did for nurses last year. The difference is that the EMT provisions are in the education code. They're not in the health code. So this was not, the EMTs were not covered under the change to health statute last year. And so this would also allow, I mean, if Maddie wanted to go work for, an organization that was looking for EMTs, she would now be fully certified to be able to do that.
You're Matt
Delegate
mute.
Morgan, we can hear you.
Silence us.
Delegate Morgan, we can hear you.
And look,
Delegate-
And they should just come talk to us.
Thank you.
So Delegate Lewis, I don't know if that answers your question appropriately.
Thank you. Yes, it does. We are removing barriers to entry to these incredibly important healthcare and emergency personnel cadres so that we can get more of them. And that seems like a good thing to me. So if that's what this bill does, I'd be happy to vote in favor. Thank you, Mr. Chair.
Delegate, thank you. Thank both of you. Delegate Hutchinson.
Thank you, Mr. Chair. Delegate Solomon, I just wanted to share with you before we came on board. I was actually pretty excited during the testimony, having been a former volunteer fireman myself and looking at how my 28 volunteer fire companies could potentially increase their ranks. But I did reach out to the State Firemen's Association to ask if they were excited about this bill. They said they were really monitoring it and didn't see that it would be able to help increase the number of volunteers in the state because they would be required to have a background check, and to have a background check, you needed to have a social security number. There has been some discussion, debate whether an I-10 is still available to do that. So I just didn't know whether you wanted to comment on that.
Yeah, I mean, so my understanding is you can do a background check. We've had sort of similar conversations in the past around childcare workers. I believe you can do a background check without a social security number. I wouldn't stake my life on it, but I am pretty certain that you can. And again, you heard directly from, the Wheaton Rescue Squad, as well as, the folks at MIMS, who I think are on here, that this is absolutely, our Wheaton Rescue Squad will put her to work immediately as soon as she is licensed.
Thank you.
Yes. Robin Elliott.
Hi, Robin Elliott. I did not weigh in on this bill, but I worked on the bill last year. So I have some, for nurses, so I have some background information that might be helpful. So Maryland's law has a provision under family law that requires all licensure boards to check for a social security number. And that was the result of making sure we're working with other states on collecting back child support. But the feds have put out guidance in the late 90s that clarified that in addition to a social security number, a state may use an ITIN or may use other measures. So the real, I know through the work with the nurses that you can do a background check using an ITIN, and it happens regularly. And ITINs have the same number of numbers as social security numbers. And so the systems work easily. You don't need a special change in the system.
Thank you. Is there a motion? Has there been a motion, council? Yes, there is a motion.
There was a
in
motion.
favor. Okay, all those in favor of the favorable, please say aye.
Aye.
Anyone opposed? Anyone opposed? There are no votes in opposed. Thank you. House Bill.
Delegate Morgan's hand just went up, so I think he was opposed.
Okay, I apologize. Thank you, delegate.
I apologize to the committee. I'm doing like 12 things here, so I just want
We
to
heard
keep
some
track
of
it.
them, yeah. No
Sorry
problem.
about that.
No problem.
Thank you, Mr.
Okay.
Chair. I'm gonna hop off. Thank you all.
Certainly. Finish your reading. House Bill 755, State Board of Social Work Examiners.
This bill alters the
Delegate
member.
Morgan, put down your hand, I assume. Okay.
This bill
Good.
alters the membership of the State Board of Social Work Examiners by authorizing the board to include at least one member who is either a licensed certified social worker or a licensed master social worker who is approved for independent practice. The bill also specifies that if a licensee of a specified license category is not appointed to the board within 3 months of a vacancy, a licensee of any license category must be appointed immediately if that licensee is otherwise qualified to be a board member. And the bill also makes clarifying changes and removes obsolete references to certified social worker license. There are no amendments.
Is there any discussion? Is there a motion?
Move favorable.
Second.
Favorable, and there is a second. All those in favor of the favorable, please say aye. Anyone opposed? Okay. We are done with today's work, but I would just remind the subcommittee that in the coming weeks, we will have a heavier caseload, and we look forward to working on those bills as effectively as we have on the bills thus far. Thank you so much. We are adjourned.